Well, Rochester General's come a long ways in the 22 years that I've worked here. Lately, things have improved greatly, and I really like the fact that employees have a say in the future and what the policies are at the hospital.
I do think that it's teamwork, and the approach is always in a teamwork approach, and we do have the upper-level support and the administrative support that we need, especially at this hospital. Our president, Annette Leahy, is very supportive and is able to allow us to get our mission done in the right way.
I think it's come with some of the changes that we want to do so well that, again, we're being empowered to make some of these changes. We're being empowered to act on our own. We're not having to wait so long to make decisions. We're not having to wait so long to provide the service that we need to be providing. And I think people are noticing that and feeling pretty good about it.
People aren't always just looking out for themselves. I think you get that in other places, perhaps places I've worked at years ago. People are here really, it's a very collaborative and a very team-oriented environment.
I think if you look at RGH, for me, I have a very competent and well-equipped surgical ICU. I have a fantastic operating team in the OR. I have state-of-the-art equipment. I have consultants whenever I need them, cardiologists, pulmonologists, infectious disease. But the system's not so big that it's encumbered by too much bureaucracy. So I've got everything I need, but I can still pick up the phone and call the consultants and say, hey, I'd like you to stop by and see somebody, and everybody still knows everybody. It still has a community, small town feel, and I think that's important.
We have telemedicine, which is a connection, between us and Rochester General, which brings out subspecialists that don't usually come out to this area. So there's a connection there that wasn't there and isn't there in any of the other community hospitals.
The agency provided support for me educationally. I got my graduate degree while I was here at Rochester General, and I got a lot of support from the administration and the co-workers.
I'm very happy with the choice that I made to work here. I have been able to grow as a professional. I have learned so many things from our residents. I've had leadership opportunities that haven't been offered to me in other places.
To provide the best health care possible, the RGH has enabled me to feel as if they're a family. Although we have 9,000 people here, I feel like I can turn to any other co-worker and employee and ask them for anything, and they'll be there to help me out.
I think it's the people. The people respect each other. I feel that they're hardworking, they're dedicated, and it's nice to be a part of that because that's kind of how I like to practice, and it's nice being supported by similar people.
I've been very blessed to be given the opportunity for these institutions, and I loved it every day I worked. I'm probably one of the senior most psychiatrists here. Worked here for since 1972, so that tells it.
Being surrounded by so many positive people, it encourages you. You want to be here, and if you want to be here, then you get a chance to do what you feel like you love to do every day, and I think that allows me to be who I am and do what I like to do every day. So
to me, it's really a blessing be working in this place. I've been here for 10 years, and I see a lot of things. But every day, even if I'm sick, last week I was sick, I don't want to stay home. I want to come here because I have a wonderful partner, co-workers. Doesn't matter for what you're going through, they always is with you, showing we are really like a family, and that's how we work every day.
We're all family, and you can see the people working at the desk, you can see the people in the building facilities, the physicians, the nurses, any of the support staff. We're all one. We're all considered equal, at least I feel that way, and that we're, again, focusing on providing the best of care that we can to our patients.
I think that's the attitude. We work and play together, and it makes for a great work environment.
I'm proud to be, here at Rochester General Hospital where we can make a difference.